Okay, it is time to start. Hello, everyone. My name is Kara Moncrief, and I am the Clinical Communications Director for Sinclair, North America. And today, super excited because we have a very special guest, Dr. Akef, who is the chairman for CBAM, which is the Canadian Board of Aesthetic Medicine. And he is joining us to do a live demonstration with our EnerJet. And the EnerJet is our newest device that we have released, and it's super, super exciting. So the first part of the webinar, I'm going to share my PowerPoint, just go through a few slides with you so you guys really understand the EnerJet and how it works. And then I'm going to pass it on to our very special guest, and he is going to be doing the live demonstration for you guys. So super excited about that. Okay, so give me one moment. I am going to get my PowerPoint pulled up here. And this portion shouldn't take too long. Would say maybe 20-30 minutes, and then we'll be able to do the fun live stuff and how the system works, and he'll be able to take any questions that you guys have. If you want to write in the questions, then I can ask him, or you can even unmute yourselves and ask any questions that you would like. So, okay, so first of all, what is the EnerJet? And what does it do? So first I'll talk about everything that it treats, and then I'll go into the technology and how it works. So we are able to do kinetic facelift. I hope I'm not freezing because it's showing that I'm freezing on my side. So if for some reason I'm like frozen and you guys can't really hear me, just let me know. But it can do a kinetic facelift, which is what we are going to be showing today with the live demonstration, where we're injecting into the scalp for an overall face and neck lift. It can treat acne scars, keloid scars, hypertrophic scars, dermal thickening. I've never seen dermal thickening like this in my life. I've never seen acne scar correction like this in my life. It's an all around amazing device. And then fine lines and wrinkles, of course, that kind of goes hand in hand with dermal thickening, right? Because we're just rebuilding that dermal structure, stimulating those fibroblast cells. And how are we able to do that? So the EnerJet uses a high velocity jet stream. And this jet stream enters the skin at 200 microns. So it's a teeny tiny entry point. So we're not doing any epidermal damage. Now, when it gets deeper into the tissue, then we get a lateral dispersion of whatever material, therapeutic compound that we're using within the skin. And I'll talk about what those therapeutic compounds would be. And then once it's in the tissue, the material that we're using bursts into tiny nanoparticles. A nano is 1/1000th of a meter. So tiny particles that then will integrate into the tissue seamlessly. So what are we using? I'll talk about that first before I go through the rest of this slide. There's different materials that we can use. I would say most common is going to be a cross-linked HA, so Restylane, a Juvederm, Define, a Refine, an Ultra, that kind of product, a filler. And what we're doing is we are highly diluting it. And it's 9 ml of saline to the 1 ml of the syringe of filler. So it's highly diluted. And once we have the dilution, we then put the syringe into the handpiece, and you'll be able to see all of that in just a few moments. And that's what then enters the tissue and then breaks into those nanoparticles. So why would we want to do that? So for an example, if I were to do dermal thickening, how are we going to get optimal results? Well, one, the high velocity jet stream that's penetrating the tissue is already creating an injury, right? And a controlled injury is always good to the skin. Why is that? It's because we're stimulating those fibroblast cells to then go over to that injured area and start to produce the collagen, right, that we need, and start to strengthen the elastin. As we age, we lose collagen, our skin starts to thin, but then our elastin also degrades. So we want to make sure that that's nice and healthy. Additionally, how long does filler live in the tissue? It can be 6 months, it can be 9 months, it can be 12 months, it can be 16 months, depending on the filler that you're using. Why that's such a huge positive when we're using it with this technology is because it's long living, it integrates into the tissue seamlessly. And then over all of that time, it's constantly building collagen. There's constant fibroblast cell stimulation. But additionally, the glycosaminoglycan really increases, right? That overall just hydration and the plumpness to our tissue just really skyrockets. And we have studies, and I have slides to show you in here of how much increase we get of the fibroblast cell stimulation and then the glycosaminoglycans. And that's why I'll show you a before and after photo of dermal thickening, and it is just incredible. I'm nervous because it looks like I'm freezing on my end. I hope I'm not freezing my nose. Okay, so, and if I am, you guys can write in the chat um, if I'm freezing at all, because it looks like I'm completely frozen. Maybe somebody just write in if I'm frozen or not, just so I feel better. Oh no. Chat, okay. You maybe now. Or before. Okay. It's showing that my camera's not even working anymore. Hang on 1 second. I'm just going to stop sharing. See if my camera comes back up. Okay, I think my camera's back up. Now I'm going to share again. All right, I think I need to reboot my Wi-Fi. All right, so let me look in the chat again, see if I'm okay and I'm back. Better. Okay, perfect. Sometimes I have to do that. So anytime that happens, just send me a quick message and it can kind of come back, which is weird. Okay, so anywho, it's entering the skin at the 200 microns. Now, we have the ability of going up to 6 millimeters deep. That's very deep. We're usually never working in that kind of depth, but it does have the possibility of doing so. But we're usually working much more superficial than that. And then it has a 10 millimeter lateral spread. So it really covers a large area with these nanoparticles. And then I talked about the rest. So we can move on to the next slide. All right, so there's a video of it showing injecting into gel. It's a bit different when you're injecting into tissue. We get much more of a dispersion, but just a nice little video of kind of showing how it works. And then that's a nice slide of kind of capturing all of the specs, how quickly it's working, the micron that it's entering the skin, how deep we can go, how wide it goes. I like that slide. Okay, so now I'm going to skip over that. What I do want to mention is the fact that it's incredibly safe, because a lot of times we hear like this high velocity jet stream. Is it going to create any damage to our blood vessels? Are we going to be able to get any type of occlusion? Is the material entering the vascular system in any way? Because if you're an injector, you already know that these are big things to avoid, right? And we have done so many studies over the years. We just got the device here in the States. It took us a little bit longer than the rest of the world. The rest of the world has had this system for a decade. So a ton of studies have been done on it. And we have the proof that the particles are small enough that they are never going to enter into the vascular system. Oh my goodness, hold on. Something weird is going on there. Oh, so odd. I've never had this happen before. I'm so sorry, you guys. What a bummer. Okay. I'm gonna try. Man, bummer. Okay, I'm gonna try to get through like a couple more slides, and I may just pass it on to the referees because it's frustrating if it's not working. It's just that I never had issues with the internet either. Okay, I'm gonna try one more time and show you the most important slides, and then we'll let Dr. Keefe talk a lot about it. All right, let me share again. I think that's when it happens, is when I share, but I'll try again. Try again. Okay, so we're never getting into that risk of any of the particles entering the bloodstream. Incredibly safe. All right, I'm gonna try to move on quickly. Kinetic facelift. This is what we're going to show you today. I won't spend much time on this slide because he's going to talk a lot about it. I'll also talk while he's doing it. But we can do correction of necklines, which is really, really hard to treat and a really popular treatment nowadays because of tech neck, right? We're all looking down, every single one of us. So we're starting to get those deeper lines. So it's incredible for that. It's also incredible for areas like above the knee, the décolleté, the skin that just has overall elastosis, right? Just so much aging, dryness and crepiness completely transforms that tissue, which is incredible. Scar tissue, acne scars, or scars in general, it's really great because it creates a liquid subcision effect. Scar tissue is anchored, right? So that jet stream will de-anchor it, that tissue will rise, and then we have all of the particles that are living in that tissue to stimulate so much fibroblast cells. And then also we use a little bit more, a higher viscosity, lower cohesivity, and a higher G prime for scar tissue, so we can get a little bit of a raise to the tissue at the same time. So it's incredible for scarring. It can treat keloid scars. We're not using a cross-linked HA. We're using a, oh, I'm freezing again. Oh, man. Why? Why is it doing this? Okay, let me, hold on. Okay, I'm just gonna talk. I hope, oh, I think I'm frozen still. It's been delayed. Let me try stopping and starting again. I'm just gonna talk for a few minutes. Yeah. All right, I think Dr. Keefe, I'm gonna, oh wait, I'm back. Okay, let me just talk for a few moments and then I'm gonna pass it off to you. But we're using for keloids, corticosteroids. So we are not using the cross-linked HA, a steroid to really control that overabundant amount of collagen production that we get with keloids. I have some great before and after photos that I'll try to share with you guys at the end of the webinar, maybe not right now. I'm going to go back and share one more time because I'm just going to show you a couple studies on the proof of the fibroblast cell formation and the glycosaminoglycans. It's one of my favorite slides, and I just want to be able to share that with you guys, and then we can pass it on. Okay, so let me get to it. And then while he's talking, maybe I'll be able to talk too. Here's an example of what the papules look like, tiny pinpoint bleeding, entry point. This is what it would look like for if you were doing dermal thickening, tightening, and acne scar correction. They heal very quickly. There's no true downtime to it. This is the study showing the depth of penetration. depending on the pressure that we're using. But this is the slide I really wanted to get to because I don't want to freeze again. I want you guys to really look at the bottom two. This is 1 month after the treatment, and the blue color is the increase on glycosaminoglycans, which is huge. Bottom photo is the fibroblast migration. Okay, I'm gonna stop there. I'm just gonna stop. I'm gonna stop. Okay. I don't know if you can hear me, Dr. Keith, but if you want to turn on your camera, I'm ready for you. If you're ready, I don't know if anyone can hear me right now. This is I've never had a webinar like this. Oh, okay, great. I see your camera's on. I'm gonna pin your video. And then let me find your other video here. I added another pin to your other video. I'm going to remove my pin, but I'll still be on. And then you're still muted.
Okay.
Oh, there you go.
Excellent. So I'm hoping that you can hear me. Let me just make sure that the sound is good. Is the sound okay?
Yep, it's perfect. If you can hear me, it's perfect.
I can hear you perfectly.
Okay, great.
Thanks again for the invitation from you and also the St. Clair company. As you mentioned, my name is Dr. Reza Akef. I'm an aesthetic physician and also the chair of Canadian Board of Aesthetic Medicine. My practice is in Toronto, and I'm very, very honored and proud to be here today. And I'm very excited to show you a very innovative technology, which is the EnerJet. We all know that this is a new technology in Canada, but even if it's new, I'm very excited because I had so many people who are interested in the last couple of months, and I'm using this technology. And I just want to let you know that we have more excitement today because I have also another guest here. Dr. Nosrat is here with me. He's a dermatologist from practicing in Dubai. So he's my guest here, and he's going to also do the procedure. And as he's doing the procedure, I'm going to explain. So it's going to be a lot of good things that's going to happen today. And I'm going to introduce you my beautiful model here. So she is basically had the same treatment about 4 weeks ago for the lifting of the forehead, the eyebrow, temple, mid-face. Very happy. She's back again. She wants to do the treatment again today. And all we're going to do, so we're going to do the same treatment with the EnerJet device. And I'm going to show you step by step when we do the procedure. And you will see that it's a very, very interesting. No needle, very, very minimal pain, almost no pain. We didn't use any topicals. We didn't use any local anesthesia. You will see the downtime. It's very minimal. As you mentioned, you might see a little bit of spotty that you will see, a little bit swelling and spots. But the injection side are, that's going to go away in 2-3 days. No problem. Okay, so before we start the treatment, I would like you to show you how we prepare and how we fill up our syringes, and then we're going to go and show how we loaded the device, and then at the end we show you how we do the treatment. Okay, let me start with the preparation. So I'm going to bring this here. So can we bring the camera up here and then show? Okay. Everybody can see that? Hopefully you can. So this is the kit that comes with the device. Technically inside of the kit, we do have basically this one I'm going to show you. I'm going to ask you the tip of that. It comes also with a 10 cc syringe as well. So as you mentioned, we are using a low to medium G prime product with a high viscosity. So we're not going to go through the brands because we try to be because you can use any brand of HA filler. The only thing I can tell you that it should be a cross-linked HA. It's better to use a cross-linked HA, but you can use any brand. As you mentioned, can be Allergan product, can be Galderma product, can be Stellage product, can be Teoxane product, whatever you are comfortable, whatever you're using in your office, that's fine. Okay. So what else we need? We need a saline, because we're gonna mix it with about 9 cc of saline. So we need another 10 cc of syringe here. Yeah. So that's another 10 cc syringe. So definitely we need a needle to fill it up with normal saline. So I'm going to draw about 9 cc from saline here. Is everything clear? Do I have to do any changes here?
No, everything looks great.
Okay. So I'm going to mix it with, again, 9 cc. There are different dilution ratio. So whenever you buy the device and you have also a training in your office, all these devices, that comes with a kind of a workbook, and as you can see that there is a table that show you how to do the dilution. So it's a little bit of differences, depends on the indication. So if you're doing a skin hydration, if you're doing treatment of acne scar, if you're treating the stretch marks, or if you're treating for the lifting, like a kinetic lift, there's a little bit differences that you can appreciate that. Okay, so now we need our HA, the cross-linked HA as well. Thank you very much. Well, we're gonna connect it to each other. And what I'm gonna do, I'm gonna add the 1 cc of my cross-linked HA to this syringe. And now it's time to blend. So I'm gonna use another 10 cc. And now what I'm gonna do, I'm gonna just try to mix them together by transferring the product from one syringe to another syringe. You don't need to be very aggressive. Don't do it too fast. We don't want to make too much bubbles. You usually do it 10 to 15 times just to make sure that the product is completely blended and is mixed with the saline. And then we need to use, I'm telling you that the 10 cc syringe that comes with the kit, it's a little bit smaller than the regular 10 cc's that you buy. So if you use the regular 10 cc, it might not fit to the device. So then you need to use that smaller 10 cc technically. Yeah, I think the product is good. It's nice and clean. Almost no bubbles. We try to not having any bubbles as much as we can. Okay, and now we have the tip. I'm going to pass it to Dr. Nosrati to. Okay, so you can turn the camera to the device, please. Okay. Let me zoom it along. Excellent. So as you can see, this is a device that we are using. So we are loading the device right now with a 10 cc. Then have in your mind that this is a no needle device. Everything goes by pressure. So that's why the trauma to the epidermis is very, very minimal. And the product will be spread inside of the dermis or in the superficial layers of the subcutaneous fat, depends on the pressure. And basically you will see the effect gradually, immediately, and gradually, as you will have the what we call it the collagen stimulation as well. So okay, good. So the best position is that you bring the patient down to the lying down position, and having your mind that when you are shooting, it should be always 90 degree. The grouch can do it. Go and do the sliding up, please. Just do it. Yeah. Maybe you bring the camera here or here. No problem. Yeah. Excellent. Thank you very much. And then if you can zoom it, you're just turning a little bit, turning the head. This Okay, very good. Thank you. And again, although you're using a cross-link HA, because of the spreading of the product, we do not see that vascular occlusion that we see with the regular injections of the needles as well. So that's another interesting point that I really like it. So I think I'm gonna bring the camera here. Okay, I don't need this one. So because I want to show you the setting of the device as well. Okay, very good. So you can see you can change the pressure. You can also change the amount of the liquid that you are injecting. So we usually start with a minimum amount, and then we look at our endpoint, which is the puddles and the tiny insertion point, technically. And then according to that, we will decide going higher or lower. Reza, do you want to do any changes?
So this is the pressure is on 30 and the feeling is 80. So you start with that, you put 1 or 2 shots and we check
Okay,
the end result and then adjust according to that.
awesome. So you started with a pressure of 30. So do you want to do one side and then we go to the other side? We just turn it on. Okay.
So this is a noisy machine. So
It's a very noisy, but we should always warn our patient that it's going to be a lot of sounds of noise, but no pain. You have your pedal as well? You put it stuff.
The foot pedal. I know I always forget the foot pedal. So I
Yes,
didn't
yes.
know.
Let me just bring the pedal for you. Do you see a pedal there? Can you just push it? Yes, yes. Mhm. Yeah, yeah. So we usually try 2 or 3 times until we see the liquid is coming out, and then we can start our treatment. Okay. 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 Oh, you need a chlor. Oh, can you pass me the gauze and the chlorhexidine, please? Yeah, pass me the gauze. Thank you. I'm gonna pass it to you. Yeah. Excellent.
let's start. Know that just bring your chin down a bit, no hands on them. Okay, very good.
So after the first punch, we check and make sure that we see the endpoint. If we don't see the endpoint, we're going to increase the pressure. So we need to increase the pressure.
Right.
We're going to go one step up to 35, right?
Yeah.
Excellent.
1, 2, 3.
Okay. We're going to check again. Now I can see the bubbles, right?
How much is the pain?
How much pain do you have?
Very minimal.
Okay.
So no numbing, no anesthesia, and very minimal pain.
Now we have the bubbles. Okay, perfect.
So come and check.
Yeah. I want to show you the bubbles. I'm sure everything is very clear. Please let me know if it's not, because I can see it from here as well. There's a tiny bubbles there. This is our endpoint, technically. So technically, we're going to do one side, and then we're going to compare. So how we do this kinetic lift, we're going to go one line all the way, starting from the forehead temple. We're going to go all the way behind the tragus of the ear. So as you can see, it's always perpendicular.
Okay.
Yes.
Again, there is no local anesthesia. There is even not a topical cream. No needle. Now we're going to go behind the tragus. Our patient had a history of facelift and neck lift as well a few years ago. So we might feel a little bit of this scar tissue behind the ears because of the previous surgery. It doesn't affect so much our treatment, but I just want to let you know, even patients with a history of facelift, neck lift, they still can do this treatment with no problem. The first line is finished. Now we're going to go for the second line.
So for the second line, we increase the pressure a bit and increase the feeling volume.
Aha. So now we're increasing the pressure, right?
Yeah.
Okay. Excellent. So the pressure is higher. We're going to go to our second line now.
Okay. And then chin now. Okay. Okay.
So parallel to the first line, we are doing our second line now. So technically, the product will spread around 1 centimeter in the dermis, and the depth can be around 6 millimeters. So we are still in the dermis, and if the product gives a nice hydration and lifting by adding more volume in the dermis. So again, we're going to see an immediate effect, and then we are hoping for the collagen stimulation. Hopefully, I'm going to have more results for you guys in the next few months. After I'm seeing my patient as a follow-up in the next 3 months and 6 months, I can give you more information about the collagen stimulation as well. But the immediate result was perfect. The patient was very happy, and she's back for the same treatment.
Now
that was our.
I can check.
Okay. So now after we finish our second line, now we're going to do 2 rows perpendicular to that lines, right? Yes. So we're going to technically we're going to go to the temples, right?
Yes.
Okay. Excellent.
The lateral third of the eyebrow. Short row.
We are not changing the pressure or volume now. The same pressure. Yeah. Again, just having in mind that the patient has a history of facelift, neck lift. So it might be some area, a little bit of scar tissue. So if it's scar tissue, we might need to increase the pressure at that area, right?
Yeah.
Yeah. So if you see that you don't see that puffles, that is most probably scars, then maybe you need to increase the pressure a little bit.
So now you can compare the right
okay,
side.
Excellent. So now is the time for the comparison. Okay, so I'm going to bring the camera to the front. Yes. And we're going to do a little bit of, look at it. Yeah, I'm sure you can really appreciate can you just zoom in me as well? Yes. So I'm sure everybody can appreciate the lift of the eyebrow and the forehead here. Can you just zoom in as well? Can everyone see it? I think it's very obvious here. So we have the nice lift here in the eyebrow here compared to the other side. Can you see? Can you just come back like this? Come back. Now to my zooming. Can you see the whole side? Yeah. Can you see that?
Yeah, and there's a big difference in the lower face.
You can see it. I'm not sure you're there or not, but I can see a very nice lift here with a very simple treatment, with almost no pain, very minimal downtime, and with a very minimal risk of complication, especially vascular occlusion. So again, I just started. Can come to me. You can just slide down. You can go to the other side. So continue. So again, this is a pretty new technology in Canada, but I'm sure with this results we can see it that many people will be interested to it. I had already a lot of interest in my practice, and again, I'm very excited. Yeah. Okay, Kara here.
I don't know. Can you hear me okay?
Excellent.
I didn't know if you can hear me.
Now I can hear you.
Oh, good. Yay. I was saying something earlier when you were showing her side, when you sat her up, there was a big difference in her lower face too.
Can I just sit over here? Okay.
Yeah.
Can I just zoom on the patient, please? Yeah. And again, having in mind, we just focus on tempo behind the tragus. We can definitely go to the forehead as well. We can even go a little bit below here to get the upper neck as well. But
Yeah.
even just this is simple here because we try to just to manage the time and stuff as well.
Yeah.
We can get a very nice lift with, again, very minimal invasive procedure, almost no invasion.
It's so nice. And then we can also do subsequent, we can take rows working if they need more of a lift here or more of a lift if they have really heavy nasolabial folds. We
Absolutely.
can take rows going
Absolutely.
back, which is
Absolutely.
beautiful.
Absolutely. Again, I'm very excited about this device. I'm sure that whoever is watching this video and this webinar would be excited. So if you're patients, that definitely patient selection is always important. We know combination therapy and aesthetics is very important. Like for her, we have done neuromodulators. If she has volume loss, you still need to control the volume loss with whatever you are doing. If the patient needs an HA filler for actual volume loss, you still need to continue that treatment. But this can be an add-on for the patient that they have a laxity of the skin, acne scars, mild to moderate amount of sagging. Patients want something with minimal downtime. That's going to be a very good treatment.
Yeah. And also if they have, this happens a lot when they have a last minute event and it's like, oh, there's not a lot of time to, maybe do filler in the cheeks to lift heavy nasolabial folds or whatever it is that's bothering them. Because it is such an immediate lift for quite some time. Then of course it takes the body longer to produce the collagen. But it's great for those last minute, like, oof, I need to look really good and I don't have time for downtime.
Absolutely. One of the areas that I'm really excited to see the result, that I'm actually I'm seeing a patient tomorrow. It's for the necklines. So that's one of the areas that is very challenging. We know that you're injecting fillers, you're injecting collagen stimulators, the patient come back with a lot of lumps and bumps and stuff like this. So it's very challenging for treatment. I really want to see how I can get improvement with this device.
Yeah, you're gonna love it. Another area that's my absolute favorite is the décolleté, because for us women, especially when we hit about 40, that's when it really starts to show the aging in the décolleté, and wearing bras, and we have those deeper lines because of it. That really crepey skin, and also above the knees. You're going to be blown away when you start to do a lot of patients in those areas, and they're so incredibly happy.
Absolutely.
So I wanted to open it up if anybody has any questions. I think we just got one question in, but feel free to ask any questions while we have the doctor on, which is great. But one of the questions is, and then I can take it or you, but how long do the results last? That's always like number one question that we get, right?
Yeah, I think most probably you can answer better because my experience is still very limited. I can give a better answer to this question in the next few months. Hopefully, me and you are going to have another webinar in the next 3 to 4 months, and I have a much better answer to this question with all the before after that I'm going to collect now. But so far, the immediate result was really good. But you're hoping to see that collagen stimulation, and you can see a better result in the next 3 to 6 months as well.
Yeah. So I'm so bummed that I can't share my PowerPoint with you guys. I'm sorry, but we did do a lot of studies on this topic. How long do the acne scar correction? I mean, when we have acne scars, we kind of live with it for the rest of our lives. And I say we because I had horrible acne and acne scars. And then aging, of course, we can never stop it. But the positive about this device is because if you're using the cross-linked HA, how long it lives in the tissue really will determine how long those fibroblast cells stay active. So if you have a long living filler of like a year, you know that the glycosaminoglycans are so heightened, as well as the fibroblast cell stimulation for a much longer period of time than just doing, let's say, something like radio frequency to the tissue. So that's where it really, really shines, is that you're going to have a long lasting result. Now, I would still recommend whatever condition they came in with, that you can do a maintenance session 1 a year. Maybe they need 1 every 2 years, but it will be a long lasting result. Another question that we got was, is it good for every skin type? Yes, 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 and yes, because it's not using heat. I'm sure that's one of your favorite parts about the device, doctor, right?
Yeah, absolutely.
Yeah, because it's not using heat, it's incredibly safe for all skin types. Now, it is creating an injury when it enters the tissue, but because it's only 200 microns, it's such a small entry point that we do not have many cases of PIH or hypopigmentation. Um, of course, you can still prep, much darker skin types, like your darker skin type 6s. You can prep their skin before the treatment to reduce any type of risk of PIH, but it is incredibly safe for all skin types. Okay, we got another
Absolutely.
question. Let's
I'm
see.
actually thinking about, let me just bring this volume down. I'm just thinking about trying to use a non-HA product as well. I know most probably something that you do not have on your protocol, but I just want to see if I can use collagen stimulators such as calcium hydroxyapatite, or a mixture of the HA and calcium hydroxyapatite, and use it for collagen stimulation. Again, if you have any experience, please share with me. If not, I would like to try it and see how this works when you combine it together.
Yeah. So I was originally asking that question when we received the device finally in the US. I was asking some of the physicians overseas if it had been done. The problem with it is that they're much larger spheres, right? So it's the problem with, can it actually come out of the jet stream of the handpiece with the spheres being much larger. It is still something that I'm looking into with a different type that has smaller spheres, that it may be a possibility. So it's an unknown right now, but we're really starting to dive into using PRP with it and having doctors studying that. So I always like to say it's a vessel for so much. And think of how much our industry has grown in the last 5 years. And then imagine the things that will come out in 5 years from now, that you already have this machine, you have this vessel that you can use without having to do injection. So it's super exciting. For example, we have a protocol for hyperhidrosis using Botox on the palms of the hands. And yeah, so there is so much that we can do. It's just diving a little bit deeper. And that's one of the things that I'm diving a bit deeper on. We have two more questions that came in. One, and it may be different where you're at in Toronto compared to the US, but how much are you typically charging per treatment?
Is the question about Canada or about US?
I think it was just in general. So I can tell you in the US, we're charging, the very low end is 1,000 per treatment, because you also have to consider your filler cost, right? But it's typically around 1,500 to 2,000 per treatment in the States.
Again, because right now I'm trying to get more patients, so I try to bring my prices a bit lower.
Mhm.
But as you mentioned, so you need to use at least one syringe of filler. It depends on the area. If it's the full face, and as you mentioned, the upper neck and area as well, you might need to even use two syringes of filler. So technically, I would say at least $1,000 for one sessions of treatment. Uh, but definitely you can charge more as you get more experience, or depends where you're practicing. But
Yeah,
I would say
exactly.
around $1,000.
Yeah, it there is a big component to, like you just said, where is your practice, and prices may vary based on that. But the positive is what they just showed, the kinetic lift, the full kinetic lift takes 15 minutes. So it's also, as a physician or your operator, it is the time that it takes you to do these things, right? And then your filler cost. Okay, we have another question. Let me see. What would you, oh, no. Are there any protocols on toxin or PRP with EnerJet? Oh, I just answered that one. So they did do the study on toxin. And it works. It works great for hyperhidrosis. Now, it wouldn't be used to do toxin like in those areas for fine lines and wrinkles, because there is such a dispersion that it's not as controlled. But for hyperhidrosis, it's amazing. And yes, with PRP, we have quite a few doctors that are starting the studies on that. And hopefully we'll have some really good information for you guys really soon. All
Just,
right.
just, 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 just to say something. I mean, a comment about using the neurotoxin. Uh, One of the area that we can mix the HA with the neurotoxin, and I'm sure that you will get a very good result. I already do it right now, but not with the EnerJet, but I want to try it tomorrow. Is for the neck. So we know that the platysma has a very important effect in the contractions and making tiny wrinkles in the neck region. So if you added a tiny amount of neuromodulator, for example, 20 units of Botox Allergan to your product, and then use the EnerJet for the whole area of the neck, that might be also another option that you can help with the lines and also improvement of the texture of the skin as well.
Super interesting. Yeah. So, and that's the thing, when we have partnerships with doctors like yourself on thinking outside the box on where can this all go. We have the most amazing vessel that shockingly doesn't hurt. So when the thought of hair growth came up, well, for men, because that's typically who's facing hair loss, not always, women too, but especially men. So sorry, doctor, you guys are not the best with pain when it comes to cosmetic
Of course.
where us women will just say, bring it on. So for men to be able to sit through so easily, a treatment with this to get hair growth, I mean, that's, it's huge. So it's looking promising. So it's super exciting. And actually, ooh, maybe I'm not allowed to say something. We have a paper, it hasn't been published yet, but it's coming out soon, that we have the proof of hair growth with the EnerJet. Not using PRP, using other materials, but that's going to be published, I think, in the next month. So we'll definitely be sharing that on, all of our social media. And so you'll be able to see it, which is exciting. All
Absolutely.
right. Let me
Love that.
see if there's any more questions here. I think that was it. Any more questions, guys, before we pop off? Let me scroll back and see if there were any that came in earlier. I'm so sorry I wasn't able to go through my PowerPoint and showing you guys the before and after photos. But of course you can always request before and after photos. They're quite easy to find, so hopefully you'll be able to see them. All right, well, we don't have any more questions coming in, but I want to thank you so much for your time. I think maybe we'll just cut out the first portion of this entire webinar and just have you when we post it to YouTube, since it was such a mess. But thank you for hanging in there with me. And I really, 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 we do at Sinclair so value our partnership with you. And we really appreciate you taking the time to do this webinar. And thank you in advance for our upcoming events that we're going to be doing together.
Absolutely. Just want to say also thank you to St. Clair Company for supporting us, and also the CBAM organization for supporting as well. I also want to say thank you again to Dr. Ghostwriting here.
Yes,
He's,
thank
one
you.
of the best dermatologists, and we always learn from him every day. And thanks everyone for joining this webinar. Hopefully it was informative. And
Yes.
see you soon. As you mentioned, we're gonna have an event in Toronto soon.
Yes, super excited. And thank you to the patient too. We really appreciate it. It's not always easy being on,
Thank you very much.
on camera, being on getting a treatment. So appreciate everybody's time. All right. Thank you so much.
Thank you. Bye.
Bye, guys.